The 14 signs of vitamin D deficiency. In this video we shall discuss the 14 symptoms of vitamin D deficiency. In a moment too we shall reveal the 3 substances to take to boost your vitamin D levels. Want to transform your health for free? Simple, just subscribe and click the bell icon to get notification of all our new videos upon release. Vitamin D regulates the expression of hundreds of genes, and is integral to biological functions that affect every bodily system. As you'll see in this short video, vitamin D insufficiency or deficiency can trigger several generalized symptoms that you may have associated with other health conditions. It is also called the sunshine vitamin since your skin makes vitamin D when exposed to ultraviolet light from the sun. Vitamin D performs many functions within the body, including maintaining adequate levels of calcium and phosphate, essential for normal bone mineralization. It helps reduce inflammation, which is necessary for the modulation of cell growth and immune function. Vitamin D also affects genes that help regulate cell differentiation and apoptosis. The main indicator of your vitamin D level is 25-hydroxyvitamin D, 25-OHD. Data collected from the National Health and Nutrition Examination Survey in 2005 to 2006 showed a deficiency prevalence of 41.6% in the U.S. population. However, as we discuss later in this article, as many as 80% of people may be deficient in vitamin D. It's important to note that how the measurement of insufficiency and deficiency is defined depends on the serum concentrations used. Some researchers use a level of 20 nanograms per milliliter, ng/ml, or 50 nanomoles per liter, and mol/L. The ng/ml is used most frequently in the US and n-mol/L is the standard in Europe. However, Grassroots Health Nutrient Research Institute recommends vitamin D serum concentration levels from 40 nanograms per milliliter to 60 nanogram per ml or 100 nanomole per liter to 150 nanomole per liter. At this level, the number of people who are likely deficient in vitamin D would be significantly higher. 14 signs you might have a vitamin D deficiency. During cold and flu season, and the COVID-19 pandemic, it is essential to maintain healthy levels of vitamin D to help reduce your risk of viral and bacterial illness. A blood test is the best way to determine your vitamin D levels, but here are some symptoms that may indicate your levels are low. 1. Aching muscles. Nearly half of all adults are affected by muscle pain. Researchers believe most of those are deficient in vitamin D. Some studies have suggested that nerves have vitamin D receptors that affect the perception of pain. In one animal model, research demonstrated a vitamin D deficient diet can induce deep muscle hypersensitivity that was not connected to low levels of calcium. 2. Painful bones. Vitamin D regulates the level of calcium in your body, necessary to protect bone health. Vitamin D deficiency can cause your bones to soften, called osteomalacia. This may be a precursor to osteoporosis. 3. Fatigue. This is a common symptom of a variety of different health conditions, including sleep deprivation. Researchers have found that supplementing cancer patients suffering from fatigue can improve their symptoms. In one study using 174 adults with fatigue and stable medical conditions, the researchers found 77.2% were deficient in vitamin D. After normalizing their level, the fatigue symptoms improved significantly. 4. Reduced muscle performance. Vitamin D deficiency is as common in athletes as in others. Vitamin D is crucial for muscle development, strength, and performance. Older adults taking a vitamin D supplement have a reduced risk of falls and improved muscle performance. Correction through oral supplementation or sensible sun exposure may reduce symptoms of stress fractures, musculoskeletal pain, and frequent illness. Vitamin D also has a direct effect on muscle performance. In one paper from the Journal of the American Academy of Orthopedic Surgeons, the author wrote, "Higher serum levels of vitamin D are associated with reduced injury rates and improved sports performance." In a subset of the population, vitamin D appears to play a role in muscle strength, injury prevention, and sports performance. 5. Brain health. Vitamin D is also essential for your brain health. Symptoms of deficiency can include dementia caused by an increase of soluble and insoluble beta amyloid, a factor in Alzheimer's disease. Research has also found an association with depression that may be associated with the function of vitamin D buffering higher levels of calcium in the brain. Vitamin D deficiency in pregnant women can increase the risk of autism and schizophrenic-like disorders in the baby. One study of people with fibromyalgia found a vitamin D deficiency was more common in those who had anxiety and depression. Another looked at vitamin D deficiency in obese subjects and found a relationship between low levels of vitamin D and depression. 6. Poor sleep. The mechanism linking vitamin D and poor sleep quality has not been identified. But research has found people with low levels of vitamin D have poor quality sleep and a higher risk of sleep disorders. 7. Sweaty head. Excessive sweating, especially on your head, or a change in your pattern of sweating, can indicate a vitamin D deficiency. 8. Hair loss. Vitamin D is crucial to the proliferation of keratinocytes and plays an important role in your hair cycle. The vitamin D receptor appears to play a role in the anagen phase of hair growth, leading researchers to conclude treatments that upregulate the vitamin D receptor may be successful in treating hair disorders and are a potential area of further study. 9. Slow healing wounds. Chronic wounds are a major public health challenge. In the US, 2% of the population is affected by chronic wounds, and it is estimated to account for 5.5% of the cost of healthcare in the UK NHS. Vitamin D promotes wound healing and the creation of cathelicidin, a peptide that fights wound infections. 10. Dizziness. Evidence from animal models suggests that vitamin D is critical in the development of the inner ear, which affects balance and coordination. Analysis of people with vestibular neuritis, characterized by vertigo, showed lower serum vitamin D levels than in people without vestibular neuritis. 11. Heart problems. Clinical studies have shown that vitamin D3 improves circulation and can help improve high blood pressure. In one study, researchers discovered that vitamin D3 also has a significant effect on the endothelial cells that line your cardiovascular system. They found that it helped balance concentrations of nitric oxide and peroxynitrite, which improved endothelial function. 12. Excess weight. How vitamin D affects obesity has not been identified. However, data do show there is a high probability of deficiency in people who are obese. 13. Recurring infections. There have been multiple epidemiological studies that show vitamin D deficiency can increase the risk of infection and raise the severity, particularly in respiratory tract infections. Multiple studies have demonstrated that vitamin D deficiency increases the potential risk for severe disease and mortality, especially in those who are critically ill. 14. Reduced cognitive function. Data show that vitamin D deficiency increases your risk of dementia twofold and raises your risk of impaired cognitive function. And the three substances you should supplement yourself with are vitamin D3, magnesium, and vitamin K2. If you want to know the 3 steps to optimize your vitamin D levels, click the link below to read the article for free now.